primary. It's a primary prevention strategy. And remember, these are strategies, public health strategies, primary education. Secondary focuses on early prevention, early identification. So any of the screenings, how many last week were doing health screenings at senior centers? Did y'all do blood pressure? Oh, yesterday, was it yesterday? So you were participating in secondary prevention there. So keywords there are screening, early detections, also navigation. Navigation is another key word to think about with a secondary prevention, because navigating someone through treatment is trying to get them that treatment at the earliest age as possible. And then tertiary is you've got an illness, you've got a disease, we're trying to prevent further immobility or a return to functioning as much as possible. So in this case, where it's prevention of morbidity in adolescent parents and their children through appropriate follow-up. Case of diabetes, you're thinking of trying to, you're going to be educating, but the education would be to prevent blindness or amputations. So again, we're still doing education, but our focus of education is different, trying to prevent disability, further decline. So those are the key words that you would be looking for when you're looking at the options of primary, secondary, and tertiary. Okay. Questions on that? All right. And then last, just as a review for these CAP definitions, normal line of defense. Again, right here, remember, normal line of defense, if I'm asking you to choose that or one of those options, it's going to be a normal line of defense if it's a metric, a percentage of something. The actual percentage is the normal line of defense, not necessarily where it's happening or any other types of line of resistance, but the actual measurement itself. So that's what you're going to be looking for. Examples of the city's diabetes rate, city's criminal activity rate. We're going to be talking about the unsheltered and the rate of unsheltered in San Antonio and the United States. Life expectancy. Those are some examples of that. Stressors, again, anything that creates a stress to the community. Weather, it's supposed to be 105, heat index today is supposed to be 105. So everybody stay cool, stay inside, keep hydrated. But certainly that puts a stress on the community. COVID, the pandemic, ground level ozone. We had a couple of ground level ozone action days last week. We'll talk about that when we talk environmental health. A closing of a hospital. Traffic congestion. Who came down Babcock to the Health Science Center today? They have that lane now closed, the far right lane, and they're backed up into Callahan, and it's like when you're trying to get somewhere quickly. Now, that's easy to identify what a stressor is. Lines of resistance. How many were at a senior center yesterday? Senior centers are lines of resistance. Senior centers, because they they do activities that strengthen older adults living in the community, aging in place. So in your senior center yesterday, if you were doing screenings there, you were doing a secondary prevention in a line of resistance, which is the senior center. So you see how those lines of resistance can have those different strategies as a technique to protect the community. Okay? So those are examples of lines of resistance. So if I'm asking the question or to identify a line of resistance, it's going to be some type of, what do you call that? A subsystem or a component of a subsystem that is a strength to help build up the community. And then the flexible line of defense, remember this one, a key word here is temporary. It's a limited basis. It acts as a buffer. I gave you the example of evacuation routes. If everybody's trying to get away from a hurricane, 37 becomes all northbound. There's no southbound lanes. Spaying for mosquitoes. A few years ago, we had a Zika epidemic here in San Antonio because of the mosquitoes. There was a lot of spraying in the community to prevent standing water, to prevent the mosquitoes from reproducing. So that's what a flexible line is. And then lastly, degree of reactions. It's a result of, so because of the closing of a rural hospital, you've had a 10% increase in death. That 10% increase in death would be a consequence of that rural hospital closing. Does that make sense? Okay. And that's the way you should look at the questions that I asked. Okay? Is he asking for a consequence? What's the result of this happening? That 10%, I would ask you with the question in the frame of what does that 10% indicate? Or what that 10% is because of that rural closing, that's an indication of a degree of reaction. Okay. Questions on that? Mm-hmm. Right. So the question would be something similar to a community health nurse starts working in San Antonio. A community assessment, they see that we have 1 in 5 adults, or 20% of adults that have diabetes. 20% is an indication of a normal line of defense. Because I did not ask you in the question, or did not say that as a result of that hospital closing, you have 20% of adults with diabetes. Just the frame of the question will be what, the community nurses come in, assessment shows that there's 1 in 5 adults who have diabetes. Which one of these does that indicate? And that would be a normal line of defense, because that's an indication of the health of the community. Now, because of that 1 in 5 adults, our county, Bexar County, has the highest rate of applications, lower leg applications, as a result of having so many people with diabetes and uncontrolled diabetes as well. So look at the question and what I'm asking. If I'm going to make it clear, if I'm asking for a consequence, what is that consequence indicate, or I'm just looking for a level of the community's health. So that's what I'm saying, just be sure to look at the question, and I also will give you the 1 and 2 in the options. I won't give you a normal line of defense and degree of reaction as one of the options. Yeah. In terms of questions? Oh, okay, sure. I'll do that tomorrow. Yeah. Okay, anything else? All right, just as review for that. So as I sent out an email, if you did have a chance to see it, we are going to have a guest speaker today, person that has been previously unsheltered. Dr. Cavazos will be bringing them in at around 9 o'clock. So I'm going to go to about 8:45, another half hour. 5% increase over the previous year in San Antonio. They're not a really good statistic, right? Not a good indication of the health of San Antonio. So if I'm looking at that 5% increase over the previous years, what might be the things that have led to that? Inflation, COVID, pandemic, and people were getting evicted, right? And now they are getting evicted because at COVID, they had a moratorium. Now they are moving towards it. Inflation, housing, increasing cost of housing. Yeah. I'm sorry? Layoffs as well. So increasing, because of those factors, of those stressors, that have resulted in this 5% increase. There's new about the unsheltered that might have died because of the excessive heat of last summer. And so that's been challenging because the medical examiner doesn't necessarily put that as the #1 cause of death. Generally, there's some other chronic diseases, but certainly the consequences of that chronic disease that led to death were enhanced or exacerbated by the intense heat. So how do we look at that? How do we get a handle on that? But being unsheltered certainly is a risk for higher morbidity and mortality. So when we think about the whole concept of homelessness, we're talking about people that live in streets, vehicles, shelters, parks, transitional housing, unaccompanied youth, families with children. We also know that there are a lot of people that would be considered unsheltered, but they're living with extended families. They call that couch surfing. I've heard that term. So not a place to live, but they do have a social network in which they're staying temporarily. So homelessness is not just someone you see on the street corner that set up an encampment and that we see. It's vast. The concept of homelessness is vast. And this is just something I took out from a government report, a federal government report on where people who are experiencing homelessness tend to either migrate or live. So you see in Texas, less than 10,000, less than 10 and 10,000. But you see, of course, on the coast or higher in New York. But also you see this happening in the middle of the country as well. So again, we're not immune. We're not just experiencing here. It's all over the country. Look at Alaska. Look at Hawaii. Anybody been to Hawaii lately? And I haven't been in years and decades. But my understanding is that the encampments are on the beaches now. So you can see some of the challenges that Hawaii has because, it's a tourist attraction, but then you have encampments on the beach. And I know, particularly in Hawaii, that the cost of living is very, very expensive. So here's this annual homelessness report that comes out. This one came out in 2021. Just kind of